I'm the director of licensing. I have a PhD in molecular biology from Penn's Medical School. I worked in gene therapy there. Then I became a patent attorney. I worked at GSK's corporate intellectual property department while I was in law school. I do a wide breadth of things. Here I manage, I help to manage the patent estate with Jennifer Dogg, who is downstairs assisting people with knowing where things were. And I do all of the out licensing, but another part of my role is finding out what people are working on and thinking about how we can get it to the people who need it. Full stop. I'm not concerned with whether or not we're going to get rich off the idea. I'm not concerned with nuances that a for-profit company would be concerned with, but my personal strong feeling is that a lot of this doesn't matter unless it actually gets to the people who need it. So I like my job a lot. I really like science, and I do like to help people think about how we can move stuff ahead. So don't ever feel like you're wasting your time if you want to reach out to me and just have coffee and tell me what you do. And also just send me your papers if you're going to send something out and you want to know if it's something might be patentable in it. But I am available to you guys, and I did bring cards. I might need more for myself and Jennifer. And I also would really love for everybody to sign in if you want to be notified of more commercialization stuff, because we do tons of great speaker series out of the office. We have venture capitalists come talk about what they're looking for in projects. We have companies come talk about how they can partner with people. We have patent attorneys come talk about what's patentable, what's a public disclosure that could compromise patentability. And we have hackathons. We have business plan competitions that have cash money rewards, awards at the end. So I really encourage all of you to get on the list if you're willing. It was a sealed list that Brian Scola gave it to me, and he made me promise I would never use the list again. So the only way it can be added to our roster is by signing this freely of your own will. We're going to tape today, so hopefully everybody's okay with that. If you aren't, I guess just make sure Dan knows, because he's the one doing the active filming. And I'm going to turn the floor over to you. This will be put on YouTube.
Hi everyone, I'm Matt Tagmorian. I'm with Kerafast. First of all, thanks for coming, and thanks for joining everyone today. Before I go too much further, there's drinks in the other room, and I have some of my cards in the other room as well, and some on me. So if after the talk you have any questions, just stop me. I can give you a card or whatever it might be. And there's some information about the company in there as well. So I kind of like to talk or start all my talks with a question, just because it's good for me to know. How many people in this room have heard of Kerafast before, or purchased stuff from us, or know anything about us? All right, so it's a small number, and I do that because I'm always upfront. We are a startup company, so we're pretty small. We have 10 employees. We're based in Boston these days, but we've been around for just over the last 5 years. So what happens with a lot of these conversations that like we're doing today, I'm seeing a lot more hands raised when I ask that question. So I always like to start that way and get a feel for what the group does and doesn't know about my company. And again, before I jump ahead, if at any point you have questions, interrupt me. I'm not really here to lecture to you or tell you what I think you need to know. I'm here to answer any questions you have and give information that can help you. So if there's something specific that you think I'm missing or something to your research, just go ahead and shout at me. I won't be offended by it. So Kerafast, what we are is we are a research tools company, a reagents company. Like you might think of an Abcam or a Millipore. When we're around for another few decades, that's what you might think of us. But we're a little different than Abcam and Millipore as well. To Heather's point a few minutes ago, she's all about getting materials out there, and she thinks that the research that you're doing needs to get out there to be worthwhile. So that's really what Kerafast comes from, is that people such as yourselves do a lot of great research, and we want to highlight it and get it out there to other people in the world to find it. So we're a little different than those other companies because we don't do our own internal research and development to make new products. What we do instead, we survive solely on licensing materials from places like Jefferson or other institutions around the country, around the world. It's a sort of material that you might share through the MTA process, but instead we market it, commercialize it, and then pay royalties back to the institutions that create it on a regular basis as a different way of just getting stuff out there, maybe a little quicker than an MTA. And, what we like to say is with a little less hassle at times as well. So Kerafast, like I said, we are a reagents company. Our goal is to sell and offer unique and novel research reagents to the global scientific community. So these 3 reasons are kind of why we came about, just to give you an idea. You know, all of you are in the lab, so you know how tough it is to get to new research tools. You see a publication and you want to try something out, and you just can't always get to that. You know, funding is a difficult thing these days with NIH budget and all that sort of stuff. So Kerafast came about as a way of creating a new funding source, so that with the royalties we pay back, the goal is to fund the labs enough that they are paying for graduate students and postdocs and just new research to continue what they're doing. And as I'll probably mention 1 or 2 more times, I like to describe the MTA as a necessary evil. I think it's absolutely wonderful in terms of all the legal protection and all the ease of mind it gives to researchers and universities, but it's a lot of work. It's a lot of time. It's a lot of time for tech transfer offices. It's a lot of time for researchers to package up materials. And while you're doing something that's great for science and should be thought of as a good thing, you're not really being rewarded for it. So we kind of wanted to change that paradigm, and that's where we came about with those 3 things about 5 years ago. And so I'm going to probably skip through a couple of these early slides just because they're a little background information and gets a little less to the point of the matter. But just to kind of go into those 3 points, you know, the research tool that everyone thinks about is GFP. And you know, not every research tool is going to turn into something that's so ubiquitously used, but that just gives you an idea of something that is such an important crux in research these days, is using just that fluorescent protein. And so our goal is to get stuff like that, big or small, market size or whatever, potential, out to scientists around the world. And yeah, so we'll skip through this slide, but you know, like I said, research funding is a challenge, so we're here to kind of address that and make it a little easier and find new ways to create new sources of funding for your labs. And I just like having that picture in the lower right because I find it amusing.
Is it you?
It's not me. I will admit right now, I don't have a PhD, so I can't hold that slide.
Is that the founder of Kerafast?
Could be. Well, actually, that's one of the funny stories, and I'll probably just say that now because as we talk about MTAs. One of the reasons we got started, the predecessor to me, he left the company 4 years ago, but he was doing his PhD at Wake Forest, and at the time, or when he was doing his PhD, Kerafast had spun out of a company that came out of Wake Forest. And so we were a virtual company, some shared lab space down there in North Carolina. And he was doing his PhD, and he wanted to get a cell line out of Duke. And if anyone knows North Carolina, the 2 schools are an hour and a half apart. He almost didn't finish his PhD in the year he expected because he literally couldn't get the cell line out of Duke for a year. And all he had to do would have been 1 day to drive over there and drive back, and he would have been set to go. And so we came about as a way of speeding up that process. And so what you see here is kind of what, you know, I kind of picture the MTA system as in terms of the negative aspects. There's a lot of work goes into it, and like I said, there's a lot of good coming from it, but it's a lot of burden on these labs. And so that's what we're trying to address and make this a much more simple process to do. And so this is kind of what we've been building for the last several years. And so the idea of our program is pretty simple. And I'll go into the sorts of materials that I'm talking about here in a few minutes, but after you've published a paper, I'm sure you've all gotten emails from scientists across the country, across the world, asking questions, asking about the materials. And so what we do is take those sorts of materials, put them up in our catalog. We'll market them to other scientists around the world, both for-profits and non-profits. We handle all the financial transactions, and then we start paying back royalties on a quarterly basis. So instead of it being a lot of burden to your lab, it's something easy for your lab, something that you can get out of your hands quickly and then be rewarded for it long term. And that's our goal here, is to make this all more of a circular thing, a little easier for everyone involved. People producing materials, people writing publications, people trying to get back into science, or start their own labs, or whatever it might be. And we're trying to just make that whole process easier. And so thinking of it a different way instead of the previous slide, we always talk about providers, procurers, and kind of what that community looks like. So here, a lot of my job is to go look for new materials that have been published on and that scientists might find useful. And so we call those people providers. So What happens in working with Kerafast and getting these materials online is we talk to a lot of scientists that produce antibodies, produce cell lines, produce small molecules that are receiving MTA requests and just don't want to deal with that hassle anymore. So we start working with them. We start marketing to procuring scientists, the person that wants to try out that antibody, try out that small molecule, whatever it might be. And then the goal is what it says in the middle, is just accelerate research and make it easier and better for everyone involved. And so here it kind of gets down a little more of the crux of what Kerafast is and what we do. When I was in grad school, that -80 was one of my arch rivals. It was something I hated cleaning. It's something I had to do on a regular basis for the company I was interning with. And scientists, and you guys can correct me if I'm wrong, but my experience is that we're all pack rats. You know, you purify that protein and 6 months down the road you think it could be useful, 10 years down the road you think it could be useful, you throw it in that -80, you forget about it, you don't remember it's there, but you think it could be useful. And so what Kerafast is really trying to do is shine a light in that freezer, metaphorically, because we don't want to ruin the freezer, and bring that sort of stuff back to the market. Bring that publication about that material back to the forefront of science and show people what you can get. So I'm sure everyone here has a -80 like this, that at some point, some graduate students, some postdocs, some undergrad has to go and clean. But so what Kerafast does is we work with plasmids and antibodies and cell lines, and less graphically, here's a list of the sort of things that we work with. And so our catalog these days is over 3,000 different products related to different areas from cell biology and cancer research and neuroscience and anything in between. But like I said, it could be anything from antibodies and other proteins to small molecules and tissue samples and probes and dyes and basic any tangible research tool. It typically has a biology or a chemistry application, but generically that's what we talk about. There are kind of 4 areas of things that we don't work with, just so you know, so I'm not misleading anyone. We don't work with currently any live animals, so we don't do mouse models. We don't really have a vivarium. We don't really touch that area. We don't deal with software. We don't deal with methods, and we don't really deal with instruments because we're not really looking to get materials or items that need FDA approval. But if you're talking about basic, tangible research tools, typically something that's a finite amount except for cell lines, that's kind of the area we work with. And so I mentioned kind of at the start of the talk that we're a little different than the other research tool companies you might know. And I said the difference, one big difference is the fact that we don't do research and development to make new products. The other difference is we're willing to try anything on the market that you might want to try. And it's a little different idea than what other companies have. Another company, if you went to them with a suite of 20 antibodies, what they're going to do is they'll take initial amounts of those 20 antibodies, they'll do market research, they'll do QC, they'll test it and figure out what they want to work with. Our idea is that if you've developed those 20 antibodies and you find use for them, someone else out there in the world is going to find use for them as well. And so instead of using all that research that they do to select 1 or 2 antibodies, we said, well, let's try all 20 and figure out what scientists like, what other scientists need, and we'll get it all out there and figure out what's best for the community. So instead of them asking for some initial amounts to QC and test, we ask for some initial quantity. Generically, we call it 5 to 20 aliquots. That we would market and promote right away and sell right away and pay royalties on as soon as there's that first sale. So it's a little bit different idea. So materials get to the market quicker, and it's a little bit less hassle, but it's kind of just a different way of doing things. And so what that means is you're using that initial aliquots to test the market. So we don't have any market analysis ahead of time to tell you what will and won't sell. Instead, we're using market demand to tell us what the best material is and figure out what best to do long term with that information. And so what becomes really cool for the company, and I think for our partners as well, if you went to ask any of the other people we work with, once we sell through those initial aliquots, it's kind of the fun part of my job. We come back to places like Jefferson or wherever it might be and ask them, what do you want to do? Does it make sense to keep this material in the catalog? And then if it does, if you're happy with it, how do we do it? And generically, in terms of keeping the material in the catalog, there's a few different options. Our lab, besides being a storage facility and having -80s and -20s and 4 degrees and all that sort of stuff, it is a cell culture lab. So we do a lot of cell line expansion, hybridoma expansion, purification of monoclonal antibodies. So if we're talking long-term here about a cell line or monoclonals, we can do the production in-house to keep the material in the catalog. Kind of the other option, if it's not something we can produce, if it's more small molecule related or other proteins, we can potentially do like a sales and service agreement that works with Jefferson to fund the lab to make more in some sort of fashion. And the third option, we can use a third party to produce it. And we've done all three of those in the past. And then the fourth thing, just to be completely honest with all of you, if it doesn't make sense to you, in the experience you've had with us selling those initial aliquots, or it doesn't make sense for us anymore, or just, there's a problem, whatever it might be, we can just take the material out of the catalog, say thank you, because we obviously enjoyed it. We like trying new materials all the time. And the question always is there anything else you want to try? And we've done all of those. They've been successful in all different ways, and it's kind of the cool thing with the program, is that you get cool information, develop the market right away, and then figure out how to move forward with that information. Excuse me. So to give you an idea of kind of how the logistics of everything works, what we do is we put an agreement in place with places like Jefferson. We're working with just under 160 institutions now, and I think there's a slide later on that lists most of them. And what we do from that point is we figure out PIs that have produced materials, that are sharing materials through MTAs, or just want to give this idea a shot, and we ask them generically, what sort of antibody, cell line, whatever it is that you have. And then we have a form that we would ask you to characterize and describe it. It's a really basic form. We have actually 15 of them geared to different material types. Should ask you for like antibodies, clonality, and isotype, and antigen, if it's a hybridoma, how to grow it, and just all that basic stuff, and then publications as well. And so once we get that information, we use that to create the web content for our website and start early marketing campaigns, find scientists both from the academic and for-profit communities that might want to try that material, and then it's your typical e-commerce site in terms of going through the checkout process and taking that order and troubleshooting and helping customers with their order and all that sort of stuff. And then the last step being obviously paying royalties back to institutions such as Jefferson. So that's the whole process, start to finish in a nutshell. So kind of going into the specifics of how things work. To do all of this, there's 2 agreements that we have to put into place. One is specifically with Jefferson, and the other is with every end user that we sell materials to. So the first step, we work with an agreement that is non-exclusive, and I mentioned that as a big reason or as a big thing because one, the NIH likes non-exclusive agreements for research materials, so it's not going to impede any sort of future funding that you want to get from the NIH. 2, if you have collaborators, there's no reason you would want to collaborate or purchase material from Kerafast. You would still want to just share that material with that collaborator freely. So you can still do an MTA to share that material. And then 3, if you want to try licensing into other places as well for different fields of use or whatever it might be, you can do that as well. The agreement is also cancel anytime. I think it's cancel with 30 days notice, just so that we have an idea of what's coming up in the next 30 days and handle our production and all that sort of stuff. But if for whatever reason, you have another license come in or you just don't want to participate anymore, it's a pretty simple process, just shooting me an email, Heather an email, let us know that it's just not for you anymore. And we'll move on and try other things and say thank you and enjoy the time we're working together. Kind of the other different thing about Kerafast is we actually have 2 different royalty models and shipping and order fulfillment models. And so that governs 2 different royalty rates we have. And so I mentioned a slide or 2 ago is that we have these pre-existing aliquots. We have an option where if you keep those aliquots on campus, we can arrange for shipping from campus. And what we do ahead of time is give you all the packaging that you would need to ship out a material, so that when there's an order, we'll send out an email with a FedEx waybill, ask you to put an aliquot of that material in the box we provide, attach the FedEx label, and it goes out the door. And in that scenario, we pay 33% of net sales back to the institutions such as Jefferson. And then if your issue with the MTA process is packaging it up and taking that sort of time, obviously that scenario doesn't work for you. And so we have more of the traditional model as well, where we can take those initial aliquots into our lab, we'll do the packaging from there, and then we'll ship it from there for a slightly lower royalty rate. And it's really that simple. Those two options are kind of the biggest question when moving forward in this whole scenario. But the nice thing is neither one is written in stone. So if you're on the fence about what would work for you in your lab, I suggest starting with the higher royalty rate option. And if it turns out that it's too much work, send me an email, we switch to the other method, and you're done. And the other thing that first agreement kind of governs is it just states that Kerafast has the right to market, sell, and promote all these materials on your behalf. And the other big thing is that all intellectual property would stay here with Jefferson, so you have the ability to do whatever else you want to do. And kind of the other agreement that matters, and you can't read it, but the screenshot of it is on the right. As part of the checkout process, the last step is a click license. And it's essentially a legal agreement that replaces the MTA. And so it gives you the same sort of protection of an MTA without having to wait for it to be done or whatever you might want to say. And so our click license is modeled after NIH guidelines. Every material we sell is sold for research only, not suitable for use in human subjects. And all IP obviously is not being transferred, and I repeat, not being transferred to the end user. So if they wanted to commercialize the material further, they would have to come back to a place like Jefferson to go down that path. And then they can't transfer it to other people to use the material as well. And the other point, I should probably put a bullet point on this slide, that click license also requires that the end user cite both Kerafast and you, the source of the material, as the providers of that material, so that while you might not get the same sort of paper citations at the end of an article that you would if you're doing an MTA, you will get cited, or in theory you should get cited within the article as that source of the material. Yeah, so just to give you an idea of what we would do if you chose that higher royalty rate option. If you wanted to keep the material on campus and ship from there, these pictures are kind of generically what we would send you. I think this is geared more towards antibodies, if I remember correctly. But essentially, it's everything from the cardboard box, the styrofoam cooler, cold packs, all the way down to the packing tape. And then if it's a material that requires dry ice, say it's a cell line or something like that, we obviously can't ship that to you ahead of time and ask you to store it because it's not going to last. So what we do is we reimburse for that. So if you have, if you're shipping something like that out of your lab, if you just message a colleague of mine, tell them what the bill was for the dry ice, we can reimburse for all those sort of costs. So it shouldn't be any new cost to you and your lab. All this stuff will be sent to you ahead of time.
Do you ship everywhere in the world?
We do. So I have a colleague, his job is, our logistics guy. He'll track all the packages once it goes out of our lab or our labs here, make sure that it gets through customs, it has all the correct forms, and deals with all that sort of stuff. So the labs we partner with, even if they're shipping, once it leaves their lab, they don't need to deal with it. And they can forget about it.
Since you are interrupted, do I understand correctly that you do not deal with any material, chemical, antibody equipment that needs FDA approval?
Correct. So I haven't encountered anything like an antibody or whatever that would need FDA approval, since all of our uses are for research use only and you're not using it on humans anyways. What it's come into a few times is some instruments that people have wanted us to use. So again, if it requires an FDA approval, we're not really going to go down that path.
In my world, what caught my attention was one of your slides, you just imaging.
Yeah.
Our imaging
Right.
needs FDA approval. So
Okay. Yeah, so we have imaging, some like live cell imaging that doesn't. We used to have like an AMPA receptor probe. I don't think we offer it anymore, but that's the sort of thing that we would have. and it's just a little different. It's not being used in humans. For my world, it doesn't need FDA approval.
Could I interject super
Of course.
quick too? So yeah, as long as you're sending it for research use only, you don't have to worry about any concerns with regulatory approval. So if somebody could do it for in vivo imaging in animals, for example, then you would circumvent that issue entirely. There could be issues with if we have a license with a company for something, we'll have to look at the license and see what the carve out is for academic research use, but it's how we can license it out to other people for research use. And one of the ways that I've dealt with this before, I think with Amelia, I'm sorry, from Kerafast, and I should have mentioned earlier, I've licensed stuff to Kerafast both from my previous institution, Drexel, as well as from TJU. Was that if we had a license and there was a restriction on the research use being academic, then we put a restriction on the Kerafast license that it could only be licensed to a nonprofit academic research institution. And you may have stuff that it's simply too valuable to use the same price for licensing to an academic as it is to license to a for-profit company. And correct me if I'm wrong, what we worked out then, and I don't know if this is still the infrastructure in place, was that if a for-profit company approached for the materials, they referred them back to us, and we thanked Kerafast with a little bit of the upside, and we dealt with the for-profit companies, and they distributed to the nonprofit academic research institutions. So if you're thinking, well, I don't want to get I don't want everybody in the world to be able to have access to this for $300, $400, then we can balance that out with our way we do the deal. At least I have in the past.
Yeah, so I should mention that's generically how it still works. As a general rule, we sell both to for-profits and non-profits, and it's usually not an issue, especially if you're talking something like an antibody. Right. It's a finite material. The question usually becomes more something like a cell line, where once you give it in the cell line, they have it indefinitely. And so even with cell lines, more often than not, we sell both to for-profits and non-profits without a problem. However, if there's a reason internally here at Jefferson or wherever we're working with to kind of do what Heather was saying, to kick back a lead if a for-profit approaches us, it's something we can work into the agreement. We only do it probably 5 to 10 times out of the whole catalog, but it's something we can do. Where we would, if whoever the for-profit is reaches out to us, we introduce them to Heather, ask her to follow up with them, and then you guys go down that path of licensing it for whatever it might be. So yeah, it is possible. Any other questions before I move on?
So material, for example, GFP, that's subject to a license for us to use, do you deal with that? Do you deal with GE Healthcare to handle the GFP license?
GFP is off patent, so you shouldn't have.
Some of them are.
Right, the enhanced ones aren't, or some of the other like in-cherries or some of the reds and stuff like DS Red, I think is still on patent. But just the basic GFP is off patent, so that's not an issue there. We don't really have much in the way of third-party licenses to deal with kind of the eGFPs and other stuff like that. So a lot of what will happen up front between Heather and myself and other people involved is looking at the material and figure out if there is any sort of intellectual property that will prevent us from licensing the material and selling it. All right, well, interrupt me again if there's any other questions you have, please. And so I kind of mentioned, through the process, one of the things we would ask is either fill a disclosure form out, a reagent information form, just to tell us what a material is. And this is a screenshot of one of such forms. It's for a compound, and it's all basic information, stuff that you probably have in your head, or if it's not in your head, it's written down in someone's lab notebook. And they're all, the different forms we have are about a page long, so it's all pretty simple. And I should mention, as part of the form and as kind of part of the catalog, we ask for any referrals to publications you have on a material, but we don't require that the material that we offer or sell for you has been published on. So if you developed an antibody or whatever it is and haven't published on it, we can still sell it. I will say that materials that has been published on tend to sell better, just because scientists can go back to that original publication and see the material in the literature and understand it a little more, but it's not a requirement. So we'll have that sort of information on this form as well. And then kind of going into another difference between Kerafast and some of the other people, other companies on the market. This is a screenshot of one of our web pages for a PI out of Wake Forest University. And why it's here is because essentially any material that we sell has 2 pages dedicated to the material. And the first one, as you see here, is actually dedicated to the PI. So since we're not doing the R&D to develop these materials, we want to make sure the researchers are getting all the credit they deserve for doing all that work and doing all the science and get rewarded for it. So we have a page dedicated to each PI we work with. It has a little blurb about their labs. Sometimes a few PIs have done speaking engagements or written blogs about their materials, so we link to that sort of stuff from here. And the other thing is this page will also link back to all the different products they offer through us or materials they offer through us, and then have references you see as well. So we try to be pretty upfront that we didn't do the R&D and that these people should really be getting the credit for all the cool work being done. And then the second page is more your typical research reagent company e-commerce website. So we use the information kind of from that disclosure form to fill out this page where it has information and background about the material, a way of purchasing the material with basic information about with sizing and stuff like that, and then what's not seen on the screen because I just can't fit it well, even making it more of an eye test. If you scroll down, there's also references and all that sort of information as well. The other thing I should mention from this page, so if a person goes to the Kerafast website and finds a specific material that they're looking for, that material page would also reference back to the previous slide I showed you. So in the middle here is a link back to the previous PI's page to, again, give credit to her for all the work she did to create this material.
Question?
Yes?
So I see price out there. How do you come up with that?
It's a good question. So we price to the market generically. So what we do is a colleague of mine, once I get that disclosure form and he has some information, he will do a little bit of a competitive analysis, figure out how unique and rare material is and price accordingly. So what that means, if you're talking about a plasmid, I used to work at Adgene. Plasmids sell for about $65 because of Adgene. So that's probably where a plasmid is going to get priced. If you're talking an antibody, kind of the price range is somewhere from about $250 to about $450 an aliquot. And so in the course of his research, if the material turns out to be very novel, very rare, very unique, it gets priced on the higher end, $350, $400, something in that range. If it's a little more ubiquitous and common, it gets priced on the lower end, the $250, $300 range. And the other thing to mention here, since we are a small company and we like the interaction with all the researchers that we work with, if you want to be involved in the pricing, you can be. You don't have to be. We'll handle it ourselves. But if you have ideas about how you think it should be priced and want to talk to us about it, we're always happy to chat. So you can be involved in that process as well.
I should add, they've done a great job generally, and just keep in mind the cost, how much it would cost somebody to just remake the tools. Yeah. Sometimes, that's kind of the balance. I mean, if it's just a plasmid, they can make that, for not much. So we're trying to get it out there and make it not cost so much that somebody wouldn't just make it themselves.
Yeah, and that's the thing. Every material has a different pricing range. So cell lines, it could be anywhere from about $300 to $1,500 a cell line, and there's some that are even more than that. But generically, that's kind of the range for cell lines. Every material type is just a little different. It comes down to a lot of times if you're selling like a cell line where you can use it indefinitely versus an aliquot of an antibody where once that tube's empty, you're done. So it just gets priced a little according to that as well. And the other thing I should mention, we do our best to make sure it will sell in terms of pricing. So there's been a few cases where we work with a few PIs where they've been pretty adamant that we price it significantly higher than the market value, and those materials haven't sold. And then there's opposites happen as well, where you come in significantly below the market value and people question the quality. So there's a give and take there that we need to think about long term as well. So yeah, this kind of just reviews the whole process. I mean, at this point, this day and age, everyone knows how to check out online, but just so you see, it's add to cart, you go through the checkout. The last step is that click agreement. Without clicking that box, the person can't purchase the material because it's what is replacing the MTA and is important for this whole process. And then the cool thing that's a little different about how things are potentially done now, if the material's shipping from our lab and it's a domestic US-based shipment, materials usually ship within 24 hours, 36 hours, somewhere in that range. If the material's coming, or it's more of an international shipment and coming out of our lab, and it could take a week or so just to make sure it ships on the correct day, to make sure it gets through customs and all that stuff correctly and arrives safely, but these in cold packs or dry ice. And then if the materials are coming from one of our provider labs, it's a little slower, but it turns out to be pretty quick as well. So it usually turns out to be within a week as well. So instead of an MTA as a purchasing scientist where, it could be months if you're lucky to get a material, this is usually, a week or so and you get the material. So it's a little different, something we're very excited about. And so kind of give you what I really see as the value added part of Kerafast, besides taking these materials out of your hands and bringing it back to the forefront of science. Really, I think what we offer is all the marketing that we do. And so to give you an idea of what we do banner advertisements in online journals and all over the place on the internet and stuff like that. We run various types of email campaigns, both on a broad base branding and company level to, again, broad base, whole new catalog or new products in the catalog, as well as very targeted email campaigns for new individual products. So we have a database internally of scientist emails across the world based on research area, research specialty, and so we target people specifically from that. We go to conferences on a regular basis. I'll be back here in Philadelphia next month going to ASCB. I think we're going to SFN or AACR in April, I can't remember which one. And then so we go to conferences like that on a regular basis. And the other big thing is all the pay for search, Google AdWords. You never really thought scientists would click on that sort of stuff, but it's that off-colored box or toolbar on the right where companies or whoever pay for that click. And you're bidding against each other to get that spot, and it turns out to be a big part of our company. And then we all do the organic search engine optimization to make sure Kerafast and these materials come up as high as possible when someone's searching for this sort of stuff. And I will say all of this is a pretty dynamic part of the company. We're always trying new marketing channels and marketing techniques. So I mention these, but we're doing stuff on a regular basis. So we also do operate a blog on our website and just to drive traffic there in a different way and stuff like that as well. And kind of the other thing I want to mention, the lower half of the slide. So when you do the MTA, one of the hassles, at least from my perspective, is that after you share that material, that requesting scientists will come back to you or your lab and ask you to troubleshoot their experiment. When going through a company like us, organization like us, you don't need to deal with that anymore. Instead of going back to you, they come back to us. So we offer all of that support to that end user that you don't have to do now. And so what happens is, a group of my colleagues in Boston, they'll take technical support questions on the phone and by email. They'll do their best to answer those questions and troubleshoot experiments. And more often than not, it's sorts of storage questions versus big experiment questions. And then every once in a while, and I say it's once in a while because it's a very rare thing, but the people in this room are going to be the experts on these materials. I'm never going to be as knowledgeable about these materials as you are because I didn't do the research. And so on a rare occasion, if my colleagues can't answer a question, they might go back to you and ask your opinion. And then you don't need to interact with the customer at all, but it'd just be like a Kerafast representative asking you your opinion on something. So that's the other nice thing I think going through a company to commercialize material. And so I'm pretty sure this list is out of date just because I can't fit any more on the slide. But like I said, we're working with 157, just under 160 institutions across the country, most here, or across the world, but most here in the US. But we work with about 20 to 25 abroad as well. A handful in Canada, UK, India, Australia, Singapore, Japan, Israel, Germany, and other places I'm forgetting. But yeah, so it's coast to coast, north to south in the US, the places in Boston, places on the West Coast, and of cool thing is we have lots of institutions with big names and institutions that have smaller names as well, and it's really cool to see that unique research reagents can come out of anywhere and matter to anyone around the world. So it's pretty fun. And to give you an idea of where we're selling, we are selling, I think it's actually over 50 countries now, even though it says 40. We're selling on most of the continents. We have repeat orders for people in South Korea and repeat customers, I should say. So it's pretty fun being part of a startup company with a small number of employees, but we're really global in terms of where we reach. And so it becomes really interesting in that, you know, these materials, which maybe we're hitting away in a -80, they can go to Australia tomorrow, they can go to Singapore the next day, or just somewhere across the street here in Philadelphia. So it becomes really cool to see where they're going. And I think the last slide or two we can probably just skip.
Do you report back to the PIs?
Not directly to the PIs. So on a quarterly basis, what we do is we would send a report to Heather's office, the tech transfer office for the different institutions we work with. That would tell them how many sales there were and report on royalty calculations and all that sort of stuff. So Heather will definitely get that information. And then the other thing too, if as a PI you're curious, you can always send me an email and I'll do my best to tell you kind of where the materials are going or if they're selling or whatever it might be. I'm usually pretty quick to respond to, so any information you need.
Can you make something go slower to a competing lab? I'm just kidding.
I cannot, no, I'm sorry.
Send them the wrong reagent.
No wrong reagents there.
I have a question about aniserum. So for polyclonal antibodies, do you require it to be purified, and who would do that? Or
We
would
don't
you
require
send the
that they
aniserum?
purified. So usually what we suggest is the form that you used it in is the form we sell it in. So if you use it as a unpurified anti-serum, then that's what we would sell it as. If it's purified, then great, we'll go down that path and then figure things out.
Couple of questions.
Mm-hmm.
You mentioned proteins. I mean, you mentioned proteins on the slide.
Yep.
But you always refer to antibodies.
Mm-hmm.
Does it mean that you do not deal with any other protein?
It does not mean that. It means that I always refer to antibodies because it's an easier conversation because it's standardized a little more than just other proteins that have different market value in terms of range, very different applications, so it's just tougher to talk about. And the other difference is we can do protein AG column purifications and purification of monoclonals in our lab, whereas we don't have a setup to purify other antibodies or other proteins. Sorry.
So in effect, you have affinity chromatography setup, but not ion exchange or gel filtration.
Yeah, so we run some gels just to
No gel filtration.
Yeah, no gel filtration, but yeah. Yeah, and that's the difference. And we have a large number of other proteins, but the just difference is production. So.
And the other one was peptides.
Mm-hmm.
Do you make any peptide if we say we need a modified residue on this position?
No, we don't. So it's usually all pre-existing stuff that you've published on, the leftover or whatever. It's not something that we're going to go modify. Or
Gotcha.
even in the case of antibodies, we don't go back currently and do different conjugations and stuff like that.
Thanks.
But if you supply the plasmids, then the person can do that themselves.
It's true.
No, for peptide.
Well, the plasmid encoding the peptide, though.
No, this is only synthetic. Synthesized from the carbon.
Yes.
So you mentioned that you have cell culture labs and you maintain cell lines. How does that affect the royalty rate?
I try not to. So my goal is to keep the rates at those standard numbers I mentioned, just because it's easier for me, to be honest. And I don't want to work harder if I don't have to. It's better for us. And the other thing too is the goal of Kerafast is really to get these materials out there, and it's doing something good for science. And so that the numbers that we came up with are actually based on industry standards, and it works out that on an average, we're trying to share the profit 50-50. And so I do my best to keep it at that. And then every once in a while, scenarios change where production's much higher than expected for another protein or small molecule, and we need to go back and talk. But you know, if you're talking like a cell line or production of a hybridoma and purification monoclonal, more often than not, the wilting rates won't change long term.
Another question. So you said, like, let's say if we talk about antibody, so you like have an antibody that I want to commercialize. Probably I'll give you like 20 aliquots. So let's say it's a, you know, it sells out completely. So next time when I prepare my antibody, do you want us to do a quality testing before we give it to you, or it's as is that we have been using in our lab?
Usually it's as is as you've been using in your lab.
Okay.
And if we're talking, you know, something you're producing like a monoclonal, after that initial, you know, 10, 20 aliquots that you give us, usually what I would suggest is we would take the hybridoma and do production ourselves instead of making you do more work, even from that perspective. Any other questions?
Any room for suggestions?
Suggest away.
Yeah, the first of the 2 pages you mentioned, so there's going back to
Yes.
my postdoc days.
Yep.
So when you have some tougher question, then you contact the lab. So if that's the case, most of the time flow rates or certain tweakings in the ionic strength, etc., is done by the postdoc, not by the PI. Therefore, it would serve well if the questions are directed to that postdoc who was instrumental in the project, because the PA would not know. And on that score, I think it's only fair that you also credit the postdoc, so the front page is not just for the PI, but for the person who actually...
It becomes tough to do, and it's a problem we've run into. We don't always get told who the postdoc is, or the graduate student is, or whatever.
The paper would show you.
The paper, it should.
Right.
Should.
Well, they're also
I just-
ephemeral, though. I mean, the postdoc is going to move on after a not substantial period of time and not be in the lab.
That's also a
So
problem.
you can ask them to have a 2-page, like the product sheet Sigma supplies, or Pharmacia used to, a very well thought out what could be the possible questions, and then get the answers beforehand, so that your tech service person can refer.
It's not a bad idea. The issue we run into, and I would honestly suspect the issue even in this room, would be the activation energy to fill out that form. And so adding more questions to that form is not something I try to do. Try to make it as a small hurdle as possible to get information initially, and then figure it out from there. But you know, it's a good point. It's a very good point.
I mean,
But
maybe.
that could be put into the description, right?
Yes.
The reagent, who the postdoc's name,
Yeah,
whatever.
right.
Yeah, I think we have a few examples where we have some postdocs' names up there as well. But it's not always given, and it becomes tougher at that point.
I could see just even adding a box, you know, additional suggested contact.
Yeah, I shouldn't say that I said PI, we don't always go back to the PI. Usually the way it works, to your point, say the lab is shipping out the material, the PI doesn't want to be the contact point because they're not the ones working with that material every day, or however frequently. So the contact point could be someone else. So we can designate different contact people within the lab, or whatever it might be.
Just a thought.
Yeah, no, it's a good thought. Anything else? Well, we can wrap it up, and I'll be here for as long as you want to chat, and then I have business cards in the other room and some giveaways
And don't forget to take my business card too. Thank you for coming down and over a little bit from Boston.
Yeah,
Great.
Boston.
And thank you for lunch as well.